Hi, we are the vitamin B.
So we are vitamin B or vitamin B complex. Complex meaning we consist of different combinations of B vitamins in one capsule like B1, vitamin B2, B3, B6, niacin, thiamine, and all that. So hence the word complex. So it's either of the two, vitamin B or vitamin B complex. So that's our generic name. For our brand names, we are also known as Nephrovite, Nephrocaps, Trifrocaps, Myrivit B, Neurobion Forte, and Revitaflex. So that's pretty much the most common brand names for vitamin B or vitamin B complex. For the chemical name, it's C63H88CON14014P. So that's the chemical name of vitamin B12. So that's all for the names. And as we recall, the drugs are classified according to their pharmacologic and therapeutic effect. So for our therapeutic effect, we are a treatment for those who are vitamin B deficient. And for the pharmacologic effect, we are the vitamins. So for our pregnancy category, we belong to the category A. Allow me to introduce to you our mechanism of action. So us B vitamins act as coenzyme in the substantial proportion of the enzymatic processes that underpin every aspect of the cellular physiologic functioning. So basically, we are very essential in the cellular functioning. So as a coenzyme that is biologically active form of that vitamin, we bind to the protein called apoenzyme, creating a holoenzyme which increases the resultant enzyme's competence in terms of the biodiversity of reactions that we can catalyze. So we play a very important roles in the majority of the cellular functioning. So like I said earlier, we are very essential in the body. So for example, in vitamin B6, in its active form, pyridoxal 5-phosphate is an important cofactor of over 140 separate enzymes required for synthesis, degradation, and interconversion of amino acids. So we also function as direct precursors for metabolic substrates. So overall, we can generally be subdivided into our roles in catabolic metabolism and anabolic metabolism. The pharmacokinetics of B vitamins. For vitamin B1, it is absorbed orally with 8 to 15 milligrams per day. It may be increased by administering in divided dose with food. Widely distributed into body tissues and mainly stored in the liver. It can also be found in the brain, kidney, heart, intestine, lung, spleen, and muscle. For metabolism, it is metabolized in the liver and eliminated via urination. Vitamin B2. It is readily absorbed from the upper gastrointestinal tract where food increases the extent of GI absorption. It is widely distributed into body tissues, including GI mucosal cells, erythrocytes, and liver. For metabolism, it is primarily metabolized in the liver and excreted in the urine, where small amounts are excreted in the bile, feces, and sweat. Vitamin B5, absorbed from the GI tract, distributed to all tissues in the body, and metabolized in the liver. Approximately 70% of the absorbed pantothenic acid, or vitamin B5, is excreted from the urine. Vitamin B6, absorbed by passive diffusion in the jejunum and to a lesser extent in the ileum. Stored mainly in the liver and is highly protein-bound. Pyridoxal crosses the placental barrier. Fetal plasma levels are 5 times greater than the maternal plasma levels. It is converted to pyridoxal 5-phosphate in the liver. Pyridoxal 5-phosphate in the liver, by the way, is the active form of the vitamin B6. For the excretion, it is eliminated mostly in the urine, where the half-life is 15 to 20 days. Vitamin B12, absorbed in the terminal ileum. Simple diffusion is responsible for the absorption when more than 30 microgram of vitamin B12 is ingested. Bioavailability of oral preparation is 25%. For the distribution, it is principally stored in the liver, kidneys, and adrenals. It is converted to transcobalamin 2 via protein binding. Metabolism, it is converted in tissues to active coenzymes, methylcobalamin and deoxyadenylcobalamin. And for the excretion, it is eliminated through urine. Folic acid, it is administered orally and rapidly absorbs from the small intestine preliminary from the proximal portion. It is distributed into all body tissues as well as into the breast milk from lactating mothers, and the liver contains about half-life of the total folate. Folate is actively concentrated in the cerebrospinal fluid or the CSF. For the metabolism, it is metabolized in the liver with a bioavailability of 50 to 100%, and for the excretion, it is eliminated in the urine and in the milk of lactating mothers.
So I'm going to talk about the indications, contraindications, side and adverse effects, and the nursing responsibilities in administering or giving vitamin B to patients. So let's start with the indication. Vitamin B is indicated in treating or preventing vitamin deficiency due to poor diet, certain illnesses, or alcoholism. It is also indicated in disorders requiring parenteral administration of vitamins like in pre- and post-operative treatment. Moreover, vitamin B is indicated as an adjuvant to antibiotic therapy and in drug-induced hyperemesis gravidum, optical neuritis, facial paresis, trigeminal neuralgia, shoulder arm syndrome, herpes zoster, lumbago, numbness of the extremities, and sciatica. When it is combined with lactobacillus, it is indicated in aphthous stomatitis or thrush. So vitamin B is indicated in pregnancy and in breastfeeding as it aids in fetal brain development and in reducing birth defects. So vitamin B, when used as vitamins in men, helps to increase their testosterone levels. Furthermore, vitamin B is also indicated in the management of neuromuscular pain, which includes neuralgia, neuritis, and neuropathies. So just like any other drug, vitamin B also has its contraindications and must be used cautiously to patients with hypersensitivity to the ingredients of vitamin B, those with diabetes, liver problem, gallbladder disease, and vitamin B12 deficiency. It is also contraindicated to patients receiving dialysis, those with active peptic ulcers, severe hypotension, and arterial hemorrhage. Moreover, it is contraindicated to patients with hereditary optic nerve atrophy, those who undergo L-DOPA therapy, and those with Leber's disease. Now let's go to the side effects of vitamin B categorized per body system. Let's start with the nervous system. So vitamin B may cause headache, dizziness, drowsiness, and ataxia. For the cardiovascular system, it has two side effects. It may cause polycythemia vera and peripheral vascular thrombosis. For the digestive system, it may cause diarrhea, nausea, abdominal pain, vomiting, and dyspepsia. For the integumentary system, vitamin B may cause flushing, itching, transition exanthema, swelling of the face and the tongue, numbness of the skin, sweating, paresthesia, and urticaria. In the respiratory system, it may result to troubled breathing and pulmonary edema. For the urinary system, it may cause toxicity to the normal renal function, which results to a more yellow urine than normal. For the skeletal system, vitamin B may cause arthritis, and for the muscular system, it may cause myalgia. Furthermore, the use of vitamin B may also cause tightness of the throat. So we're done with the indications, contraindications, side and adverse effects of vitamin B. Now let's go to the nursing responsibilities before, during, and after administration of vitamin B to the patient or to the client. So before the nurse administer vitamin B to the patient, the nurse must first assess if the patient has any signs and symptoms of vitamin deficiency and any of the following contraindications or cautions to avoid further complication. The nurse must also monitor if the patient have anaphylaxis such as wheezing, urticaria, and edema. Next is that the nurse will also conduct a sensitivity test if the vitamin B will be administered through injection. Next is that the nurse must verify the dosage order, and then prepare the drug on time. So during the administration of vitamin D to the patient, the nurse must first verify the patient's identity in order to ensure that the right medication is given to the right patient. It is also important for the nurse to explain to the patient the possible side and adverse effects of vitamin D. The nurse must also assess the administration route and administer the drug on time. The nurse must also provide comfort measures to the patient in order to help the patient tolerate the possible side or adverse effects of the drug. The nurse must also monitor the patient for any possible adverse reactions. Lastly, the nurse must encourage the patient to comply to diet recommendations from the healthcare professionals. So after the nurse administer the vitamin B to the patient, the nurse must continue or monitor the patient accordingly for any possible adverse reactions. Then, encourage and instruct the patient to report appearance of rashes, difficulty in breathing, pain, and discomfort. The nurse must also evaluate the therapeutic effectiveness of the drug. The nurse must also evaluate the patient's level of knowledge about the drug in terms of its indications, contraindications, and adverse effects. Lastly, the nurse must document all relevant data. So guys, that's it for vitamin D. I hope you have gathered relevant information which you will be able to use when you become a nurse soon. Thank you again and